Hello, my name is Evan Yu. I'm a professor of medicine and oncology at the University of Washington School of Medicine and Fred Hutchinson Cancer Research Center. Today at the FDUS, I spoke about radiopharmaceuticals in clinical trials for patients with metastatic castration-resistant prostate cancer. Briefly, I talked about Radium-223, as that is the only FDA-approved radiopharmaceutical that's shown to prolong survival outcomes for patients with bone metastatic castration-resistant prostate cancer and symptoms. So I went over the basic summary of the data from the ALSYMPCA phase 3 trial, and then I moved on to talk about clinical trials that are ongoing in the disease state. In particular, I talked about combinations of Radium-223 with novel hormonal agents like abiraterone and enzalutamide. I also talked about combinations with immunotherapy agents like Sipuleucel T or pembrolizumab per se. I talked about moving the drug earlier into the metastatic hormone-sensitive prostate cancer setting and also into the more asymptomatic clinical settings rather than the symptomatic metastatic castration-resistant prostate cancer setting. I also talked about biomarkers and the focus of the fact that Radium-223 is the only FDA-approved agent that prolongs survival for metastatic castration-resistant prostate cancer that induces double-strand DNA breaks. And with all the excitement behind about 25% of patients with DNA repair gene abnormalities in this field, Radium-223, which induces double-strand breaks, should work ideally for those patients. So the field is excited about PARP inhibitors, excited about platinum, but Radium-223 ideally should work for those patients as well. And we have some clinical case series that we're getting ready to publish in that arena. Finally, I talked about future agents. For instance, lutetium bound to PSMA antibodies or PSMA small molecules, or actinium, which is an alpha-emitting radiopharmaceutical. The advantage to these agents is that they won't just work for bone metastases, but they'll also go to soft tissue as well, and early studies have already shown some efficacy.